Realmente la pandemia, una enfermera, usted de primera mano los efectos de perder a un ser querido por COVID-19 a las fiestas de fin de año.
Joanna, thank you. Brian, thank you so much for the.
Yes, Fields. Next up, Michael Pelton. Michael, your mic is unmuted.
Michael, do you have your mic unmuted?
Can you hear me now? You got me?
Yeah.
Cool. All right. Hey, I appreciate you guys taking the time. Question for the, and you had mentioned to me that, if we continue the rise in cases over the next, where we're asking the state or the governor, what more can we do? Where do you stand on that now? And has the county requested?
Michael, I think the easiest answer for that is that public health has a constant dialogue, much a direct line to the governor's office. So have they been speaking and partnering with various things? Absolutely. Are we COVID-19 vaccine to enter our community? Absolutely. So those are the things that are going on, and there's this constant discussion about the rise in cases as well. We recognize that the governor, not all of them are like Maricopa County, of course, where 2/3 of the population of the state. And Joanna, you want to come on?
Bueno, la pregunta es, con el incremento de casos que continuar con la mitigación, los esfuerzos de mitigación, y si estamos en comunicación con la oficina del gobernador. Bueno, nosotros hablamos con el Departamento de Servicios de Salud constantemente, hacemos los planes de mitigación, también se comunica con la oficina del gobernador. Cabe mencionar que el gobernador tiene otros 15, somos 15 condados en Arizona y no todos son como el condado de Maricopa, así que la oficina del gobernador se enfoca en el bienestar quizás de toda Arizona y no necesariamente solo en Maricopa, pero sí estamos en constante comunicación con el Departamento de Servicios de Salud del estado y haciendo estos planes de mitigación.
Thanks, Mike, for the question. Ron, do we have somebody else?
Yes, Fields. Josh Sanders. Josh, your mic is unmuted.
All right, am I good to go?
Go ahead, Josh.
Okay. This is for Flanagan, and I follow-up question, if I may. But the director mentioned that 800 youth sport teams will be coming in to the state next week, knowing that the virus is widespread right now. Why is this responsible to allow these tournaments to still take place? And at what point?
Clear about what the public health at the county level is. Audio real quick, or is that his audio bleeding back? Okay, so yes, public health is not an enforcement organization. This is an organization that studies the spread of disease, monitors the spread of disease, provides guidance to community leaders and policymakers, and therefore they can make decisions on how that should happen. We do know that this is, I know as a parent that this happens every winter. Winter sports come here to Arizona to have tournaments of all different kinds because of our mild winters. So this is, if I understand it, this is not restricted at this point at the state level, and but this is still continuing to this. But as far as the public health point of view, when we talk about social gatherings, that includes standing on the sideline cheering on your children. And all of the recommendations that public health has provided for protecting yourself, just because you're standing outside, if you're not maintaining 6 feet of distance, if you're not wearing your mask, then it might not be working and you might be putting yourself and your family at risk. And so when you talk about teams and their families traveling here, you're talking about a potentially risky activity. I'm certainly not going to pass judgment on the folks that are doing this, because sports are great for our kids and our kids need it right now. They need something. So a risk We know that masks work, and they can take precautions at this time and keep themselves safe if they're going to participate in these activities. Director Flanagan, do you have anything else to add? So, Joanna, will you want to step up and answer that one? And then if Josh has a follow-up question, we'll deal with that.
La pregunta es que si llegan 800 equipos deportivos que próximamente estarán aquí en Arizona, en el condado de Maricopa, ¿por qué se permite cuando se está incrementando el número? Bueno, cabe mencionar que Salud Pública del Condado de Maricopa no enforza leyes. Lo que sí hace es informar y monitorear las enfermedades y dar la información a las autoridades correctas. Esto no está restringido a nivel estatal. Cuando hablamos de reuniones que son, aunque sean fuera, en un espacio abierto, lo que estamos recomendando sigue siendo lo mismo. Mantener el distanciamiento físico de 6 pies unos de otros, usar las mascarillas. Sin embargo, si hay un evento masivo donde hay mucha gente reunida, aunque sea fuera, al aire libre, pudieran estar en riesgo, aunque le estén echando porras a sus hijos en los equipos deportivos, en ese tipo de eventos. Así que hay que tomar las precauciones pertinentes, entre ellas el uso de la mascarilla.
Thank you. So, Ron, I believe Josh had a follow-up question.
That's correct. One moment, please. Josh, your mic is unmuted again.
Okay, thank you. I appreciate that response, but so I'll just ask the question though again this way, along with my follow-up question. Is it responsible to hold these sports tournaments knowing that a pandemic right now that is County alone the last week, and that more than 6,000 Arizonans have lost their lives to this virus? Is it responsible to hold these tournaments? My follow-up question is based on a November 18th model that came out of the U of A looking at the state that have found that if new viral transmission feels that the state needs to scale back and return to some of the mitigation efforts that we had early on in the pandemic and in the middle of the summer.
So that's the second one.
Thank you.
Thank you for the question. Answer both of them a little bit with the, we all need to think and take responsibility. From a public health standpoint, is there a student? There are, and there is a safe way for that to happen. Is that happening at all of these tournaments? From reports we're hearing, it's not happening at all of these tournaments. So that's when individual responsibility and decisions and athletes that are participating in these events. From the standpoint of the new model that came out on the 18th or see that, but I can tell you that the numbers we're seeing and the trajectory we're seeing, when our hospital systems become overwhelmed, we will have to do additional efforts statewide to help those systems relieve the pressure. We certainly can't continue to have increase in numbers and get to a point where our hospital systems cannot see patients and do not have enough beds and staff to care for those patients in their systems. So at that point, certainly additional mitigation efforts would need to take place or something would need to happen. And as Fields already mentioned, we have biweekly calls with ADHS where we talk about statewide what the outlook is. And obviously with Maricopa County being the largest here and what's happening with our healthcare systems here, since other counties do rely on our healthcare system when theirs become overwhelmed. So we do have those discussions, and there is certainly the benchmarks in place right now that say once spread reaches those areas that things will change. And so it's really important to keep your eye on those benchmarks that the state has set.
Sí, la pregunta es de casos y también acerca de la transmisión del virus de un modelo de la Universidad de Arizona que se dio a conocer el 18 de noviembre, que avisa que estará saturando el sistema hospitalario si sigue subiendo el número de casos. Regresemos a los esfuerzos que tuvimos precisamente de mitigación. Bueno, en este caso, las respuestas vienen siendo, todos tenemos que tomar responsabilidad. Todo el mundo tiene un parte de responsabilidad en esta pandemia. Si es necesario, si se puede tener actividades deportivas con los estudiantes de forma segura, sí existe la posibilidad. Pero lo que estamos escuchando y lo que está pasando es que los padres de familia y los estudiantes, quizás no todo el mundo esté siguiendo las guías adecuadas. También lo hemos visto, va a ser mucho más difícil con el Departamento de Servicios de Salud de Arizona, donde se habla de este tipo de situaciones y cuáles serían las respuestas. Sabemos que al momento tenemos que mantener la vista en los parámetros que se ha puesto el Estado para poder parar esto en un tiempo adecuado todavía.
Josh, thank you for those questions. Ron, do we have somebody else on the line?
Yes, Fields. Peter Seymour is up next. Peter, your mic is unmuted.
My question goes along the benchmarks that R.C. Flanagan just mentioned. You think it's time to, in order to stop the spread? I know some schools are already doing this on their own, but maybe if we change the benchmarks, it would encourage that. And then a quick follow-up, how fast will the county get the vaccine from the state? I know the state's administering it, but what proportion will the county get the vaccine from the state? So those two questions I have. Thank you.
Okay, so Peter, on your first question, I would refer you back to the state. ADHS set the benchmarks. We have put out the benchmarks. I certainly think at this point, moving the goalposts on any of these organizations, particularly schools, which your local public health departments deal with all the time, that is not the plan or would not be fair. You know, this is about having discussions. We've reiterated many times. There's not a one-size-fits-all approach when it comes to giving advice to schools or the businesses or the people that seek that advice from the Department of Public Health. So, but moving so you know where you stand. You have to have the benchmark somewhere, and that's been set early on in cooperation with ADHS. And so if you have any questions about if those are going to be changed at state level. You want Joanna to answer first? And Joanna, why don't you answer that question first, and then we'll have Director Flanagan come up and talk to you a little bit about vaccine distribution and what we're hearing.
Son varias preguntas, pero contestaremos la primera y regresaremos. ¿Es acaso que los parámetros que existen, como lo mencionó ya la directora Marcy, será tiempo en que cerremos los restaurantes u